Hello everyone, welcome to this detailed session on factors affecting blood pressure. Blood pressure is one of the most crucial health indicators, and many factors can cause it to rise or fall. In this video, we will explore physiological factors like age, genetics, and hormones, lifestyle habitats, including diet, exercise, smoking, and alcohol, medical conditions and their medications, and which affects the bp, environmental and psychological influences like stress, sleep, and pollution, and most importantly, how to maintain healthy blood pressure. By the end of this video, you will have a clear understanding of what influences bp and how to manage it effectively. So let's get started. So, what exactly is blood pressure? Blood pressure refers to the force of blood against the walls of your arteries as your heart pumps it around the body. It is measured in millimeters of mercury or mmHg and given as two numbers. First one is systolic pressure, second one is diastolic pressure. So, systolic pressure is the pressure when the heart contracts and pumps the blood. Diastolic pressure is the pressure when the heart relaxes between beats. For most adults, a normal blood pressure is around 120 by 80 mmHg. But this value can vary. But why is blood pressure so important? Because it determines how well oxygen and nutrients reach your organs. If your blood pressure is too high, your heart and arteries work harder, increasing the risk of heart attack, stroke, and kidney diseases. If it is too low, essential organs may not get enough oxygen, leading to dizziness, fainting, and shock. Now, next one is first factor, physiological factors that affecting the blood pressure. So, blood pressure is directly influenced by cardiac output, blood volume, vascular resistance, and hormones. First, cardiac output plays a major role. CO refers to the amount of blood the heart pumps per minute. The more blood pumped, the higher the pressure in your arteries. This is why during exercise, BP temporarily rises. Peripheral resistance is another key factor. Imagine your arteries like a hose. If the hose is narrowed, means vasoconstriction, pressure increases. If the hose is widened, means vasodilation, pressure decreases. Conditions like atherosclerosis increases resistance, raising BP, and hormones also regulate BP. The RAAS system controls fluid balance and vessel constriction, raising the BP. ADH increases water retention, adding volume and pressure. ANP lowers BP by promoting sodium loss in the urine. So, understanding these physiological factors is key to managing the blood pressure so effectively. Now, second factor, lifestyle and dietary factors. So, your lifestyle and diet have a major influence on blood pressure. Too much salt causes your body to retain water, increasing the blood volume and BP. Fatty foods lead to arterial plaque buildup, narrowing your arteries and increasing the blood pressure. Potassium rich foods like banana help counteract the sodium's effect. And physiological activity is crucial. Regular exercise strengthens the heart, making it pump more efficiently with less force, which lowers the BP. On the other hand, a sedentary lifestyle weakens the heart, raising the BP. Alcohol and smoking also play a huge role. Alcohol damages blood vessels while nicotine narrows the arteries, both increasing the BP. Obesity is another key factor. Excess fat increases resistance in the arteries, forcing the heart to pump harder. Maintaining a healthy weight can significantly lower the BP. Now, the third factor, medical conditions and medications that affecting the blood pressure. So, many medical conditions directly impact on blood pressure. First, let's talk about hypertension. It comes in two forms, primary hypertension and secondary hypertension. So, primary hypertension is the most common type and its causes are linked to lifestyle, genetics, and age. Secondary hypertension, however, is due to an underlying disease such as kidney or hormonal disorders. Your kidneys play a vital role in regulating the blood pressure. If they fail to remove excess fluid, blood volume increases, raising the BP. Conditions like chronic kidney diseases and renal artery stenosis cause the persistent high BP. Endocrine disorders also affect the BP. High cortisol in Cushing syndromes and excess adrenaline pheochromocytoma can cause severe hypertension. Thyroid disorders also affect the BP, with hyperthyroidism, which raising it, and hypothyroidism, which lowering it. Diabetes is another major contributor to high BP. High blood sugar damages artery, making them less elastic, which increases vascular resistance and BP. Medications also influence blood pressure. Some drugs raise the BP, like NSAIDs, steroids, and decongestants. Others lower the BP, like diuretics, beta blockers, and AC inhibitors. Understanding these medical influences helps us better control blood pressure with the right treatment. Now, fourth factor is environmental and psychological influences on blood pressure. Your surroundings and emotional state significantly influence the blood pressure. Stress is one of the biggest culprits. When you are stressed, your body releases adrenaline and cortisol, which cause temporary spikes in the BP. Chronic stress, however, can lead to long term hypertension. Sleep is another crucial factor. Poor sleep quality, especially in people with sleep apnea, causes repeated BP spikes during the night. In contrast, deep sleep helps the body to regulate the BP. Temperature also affects BP. In cold weather, which causes vasoconstriction, means narrowing of blood vessels, raising the BP. During the hot weather, which promotes the vasodilation, means wider blood vessels, lowering the BP. Altitude also play a role too. At high altitudes, lower oxygen levels force the heart to work harder, temporarily increasing the BP. Over time, the body adapts. Lastly, air pollution damages blood vessels, increasing BP over time. Studies show long term exposure to pollutants is linked to higher hypertension risk. Being aware of these environmental and psychological factors can help us minimize their impact on blood pressure. So, how to maintain healthy blood pressure? We have read all the factors. Now, we have covered the factors affecting blood pressure. Let's discuss about in detail that how to maintain the healthy blood pressure. So first, diet is the key. A low sodium, high potassium diet helps regulate the BP. The DAS diet, means dietary approach to stop hypertension, is highly effective. It includes fruits, vegetables, whole grains, and lean proteins. Regular exercise is crucial. Aim for at least 150 minutes of moderate activity per week, such as brisk walking, cycling, or swimming. Strength training also improves the circulation and heart health. Managing stress is essential. Techniques like meditation, yoga, and deep breathing can significantly reduce the stress which induced the BP spikes. Getting 7 to 9 hours of quality sleep every night also helps. Avoiding risky substances is another important factor. Smoking and excessive alcohol can damage the blood vessels and also raises the BP. Reducing caffeine intake can also help if you are sensitive to it. Finally, regular health checkups allow early detection and management of high blood pressure. If you have medical conditions like diabetes or kidney disease, keeping them under control is vital for BP management. By following these strategies, you can effectively maintain a healthy blood pressure and reduce the risk of complications. Before we wrap up, let's test your knowledge or understanding with some quick MCQs. I have listed 5 multiple choice questions on the screen. Drop your answers in the comments section below. Let's see how many you can get right. If you enjoyed this video, don't forget to like, share, and subscribe for more educational content. See you in the next one.